Hey everyone, it's Dr. Rick, founder of Verbal411.com, and today's special guest is Dr. Stu Hui. We have collaborated with patients and athletes in our previous Ignite Your Life conference, and those of you who haven't signed up, I'm going to give you a taste of what this doctor knows. So last time we talked, I think you did a great job with taking there's like 100 people at the last conference, and you just moved everybody. I think movement is so underrated, has a priority in life. I do have a couple of ideas as far as how to make people initiate new lifestyle change, especially with the New Year's resolution coming up. Do you have any fundamental principles that you kind of eyeball or get people to be successful with?
Sure, yeah. So whenever we're evaluating an athlete or a patient, we want to make sure that we're seeing how they move. What's the quality of their movement? Because oftentimes just laying on the table doesn't give me a proper assessment of how somebody's moving, right? So rather than just kind of testing soft tissue structure, ligaments, tendons, I actually want to see the quality of the movement. And so even though I work predominantly with athletes, the average day person, we all share one commonality. We're all human beings. So we all have to satisfy quality of movement of 7 movement patterns. And in the conference, I'm going to share what those patterns are. The best way to do it is see how a person's comfort level is and their success rate in completing each one of those tasks or movements is. And if they do it well, I progress them, make it a little bit more difficult. If they're having difficulty, I regress it to the point where they can succeed, right? And in doing so, we start to break a lot of expectations that oftentimes hold people back from getting started, right? Because as we know, like for example, like trying to lose weight, it's all of a sudden we make it such a monumental task that we don't know how to chip away at it little by little. And I think in that process, what we do as healthcare providers is we want to educate you in order to empower you. And when you are empowered, you now understand the process of what it takes to get to your ultimate goal, right? So yes, in the beginning, when we interview patients, we establish what the goal and objective is. But once we establish that, okay, great, it's there at the top. What we're doing as coaches and physicians, educators for you, is to help you understand what the steps are in order to initiate that process and continue to success in achieving your goals.
A personalized approach, but with definite basic tenets to get people motivated, continue their encouragement or performance, and then engage so that it's doable in the long run.
Yeah, absolutely.
That's always been one of the problems with my folks who are a little apprehensive with going to personal trainers or chiropractors. And you're not your average chiropractor, obviously far and above what an average chiropractor does. And you're actually not an average trainer because you're far and above. So I love the experience that you come with. Could you tell folks what your degree or accolades are?
Yeah, absolutely. So I'm licensed as an athletic trainer and also a chiropractic physician. But we try and take it to the next level. The whole reason why we developed Paradigm Performance Center is to bridge the gap between injury rehabilitation and return to play performance development. But in the years that we've been doing this, the success has brought us to extend our boundaries all the way from diagnosing, guiding patients to the appropriate cares for whether it be surgical intervention or some other care that's needed, and then educate them through the rehabilitation process, which ultimately segues into what performance is all about. So a lot of the athletes that we travel internationally for, a lot of them are severely broken. And we meet them because they're no longer able to play without pain, and they're not able to function in life without pain. And that's a huge detriment. And I'm not talking about old players. I'm talking about young players like mid-20s, early 30s that are thinking about retiring because they're in such a broken state. So our job is to step in, identify what's going on, but then change the dynamic and understanding and perspective of how they're viewing what their condition is, and now empower that athlete. Oftentimes when patients come to us or athletes go to their support medical staff, they're looking to be told what to do, right? We're coming at it from the understanding of, we want to teach you so that your understanding of what has to happen is greater. And in doing so, your awareness grows. And my whole saying to patients is, when you have awareness, you can actually do something about it. hence the whole empowerment, right?
That's interesting.
Yeah. So, and again, regardless of whether these athletes are professional or dealing with our academy players or collegiate players, we're human beings, and so are you. So we all need to move with the same quality to educate and nourish our brains, because movement is life, right? Movement nourishes how our brain controls the rest of our body. And if we lose that, that's what starts that steep downhill grade of the aging process. So Doc and I are going to be working, and the rest of the panel is going to be working to share with you what the fountain of youth is for life.
I have some great points. I think that don't be intimidated by Doc's talent as far as his elites, because not only do you take care of elites, including FIFA World Cup soccer players, but take care of average Joes and Janes.
Yeah.
But it sounds like your template for the elite athlete is kind of the same for your template for anybody that comes in injured or just debilitated.
Yeah. Or even just trying to find a better way to move.
New Year's is coming up, and a lot of people will be on their own, search the internet. What can I do to lose 100 pounds?
Right.
And you can find ideas. Now, as far as whether those ideas are actionable or not, they probably will put you into injury.
Yeah.
And then you should be seeing Dr. Stu anyway, or me. So I think if you shortcut it with the way you attack success and give it or implement it to a patient, I think you will have a better experience. I think you'll have better foundations for further pushing forward, or maybe resonating with other people that are watching you, your kids, your neighbors, your colleagues. Because that's what we want to do, is we want to empower the community to get healthier altogether.
Yeah, absolutely. Yeah, and you're exactly right. We're trying to educate you so that you can do bite-sized changes to make change in your lifestyle, right? Not to just go gung-ho and then all of a sudden the task is so monumental that you can't complete it. And then that's why so many people drop off within the first couple of weeks of trying to make a lifestyle change. So in the beginning, the most important is education.
Yeah,
so
I like that.
Yeah, and I'll usually take a lot of the things that I've learned being a former pain management director. So a lot of our former clients were on the other end of this aging spectrum, so 65 plus. And the magic didn't happen in, the hip replacement or the knee replacement or the steroid injection. Those are all temporary. The magic really started to happen when we taught them how to move better. And so when I started to ask myself the question, somebody that's 85-year-old comes up and says, I feel better than I was when I was at 60, 65. I was like, man, that's a 20 to 25 year gap there. And I can make that kind of a change on that end of the age spectrum. What can I do with an elite or with an athlete, right? And we've shown it. We've taken athletes that have been high school age and they've excelled all the way through signing professional contracts.
That is so reassuring. That's rewarding.
Yeah,
that's
absolutely. Even more importantly is now being able to help someone that's just trying to improve on their life and the quality of their life.
So we can apply this to the folks that come to the Ignite Your Life conference, which I'll put tickets to down below. Try to reserve a spot or give it to somebody else that you think is in need of our help. Otherwise, Dr. Stu, could you tell folks that are not going to the conference where your place is?
Sure, yeah. So we're located in Elgin, Illinois. The address is 870 Church Road. Our web address is www.train2perform.us. And I'll give Doc the links that he can share with you as well.
I'll put them down below. So thank you for watching, everybody. Coach Stu, thank you very much.
Thanks, Doc, for stopping by.
We'll see you at the conference.
All right, sounds good.